incoming second year or learning unit 4 intermed student from UP College of Medicine.
Good day, everyone. I'm Robert Dominic D. Gonzalez from the UST Faculty of Medicine and Surgery. I'm currently a postgraduate intern at the University of Santo Tomas Hospital, and I just graduated ng Doctor of Medicine this 2021. In terms of service, if we're talking about the healthcare or health allied field, I've been immersed already ever since 2013, 2014 during my Bachelor of Science in Pharmacy days. So back then, what I used to do was work or intern works in community pharmacy or the bodega, hospital pharmacy, research pharmacy, and also in the academy. So I teach sometimes as well. And also, right now, it's 2021 already, so that was way back long ago kung sa pharma years. So right now it's 2021. I just graduated naman from Doctor of Medicine. So I'm currently serving as a postgraduate intern in the USD Hospital.
Una kong naisip na gusto ko yata mag-doktor nung maliit pa ako at kinakalikot ko lagi yung gamit ng lolo ko sa bahay nila. Naalala ko yung locking forceps. Yun yung kapag sinara mo, kailangan ng specific na push para bumukas ulit. So, sasara ko lang yun tapos hindi ko na mabubuksan ulit. So, ayun, nung dumating na yung age na sisimulan ng tanong sa'yo kung ano ba yung gusto mo maging paglaki, ang automatic kong nagiging sagot is doktor. Kasi una, yun yung naging familiar ako kasi nga nakikita ko yung mga gamit. Tapos, pangalawa, ako kasi yung isa sa mga unang panganay na apo. Kaya noon gusto ko lang maging parang bibo na ako rin yung mag-doktor kagaya ng lolo ko, ganun. Kahit na hindi ko na siya nakita masyadong nag-practice. Habang lumalaki naman ako, nakakarinig ako ng mga kwento tungkol sa kanya. So, siya raw yung tipong mahal talaga ng pasyente, yung madalas na hindi na nagpapabayad, lalo na kung hindi kaya magbayad ng pasyente. Masagana raw sila sa mga gulay noon kasi madalas silang bigyan ng mga pasyente, gano'n. Kaya ayun, natuwa akong malaman kung anong klaseng doktor yung lolo ko noon at sana maging gano'n din ako.
Parang common na tinatanong sa ating mga nagme-med or mga nasa undergrad na science or health-related courses. So, actually, this started way back na lang nung baby or bata pa ako. Hindi naman nung baby na nasa tiyan pa ng mama. Nung mga bata pa ako na nagkamuwang na ako sa mundo. Ganun. Parang lagi ko nang sinasabi sa family or sa parents ko na, Mama, gusto kong maging scientist or doctor someday. So, yung dalawang yon yung parang napupusuhan ko back then. Tapos, syempre, mababaw pa lang yung level of understanding ko of what being a doctor or scientist is nung bata pa ako. So, as I grew older, when I entered high school, college, and postgraduate studies like Doctor of Medicine, mas naging deeper yung understanding ko of why I really want to be a doctor. And although it's cliche to hear, I have a heart for serving patients. Yung kumbaga, parang it warms my heart every time I become of service sa others.
Common sentiment sa intermed na para kaming lost sa unang 2 taon namin kasi yun yung parang pre-med namin na kinompress lang into 2 years. Kaya ever since, looking forward talaga kami sa 3rd year namin or sa LU3 o yun yung med proper. Kasi nga, pakiramdam namin doon lang talaga nagkakaroon ng sense yung mga bagay. Kaso, ayun nga, nagka-pandemic bago kami mag-LU3. Kaya, sobrang dismayado talaga kami kasi lahat ng milestones, hindi man lahat, pero karamihan ng milestones sa LU3 talaga may experience yan. So, yung mga dissection at iba-iba pang mga events. Sa online med kasi o sa Google Docs, sa WebMD kung tawagan, parang madalas namin makalimutan, med students kami. Wala yung bonding kapag sabay-sabay na kayong naiiyak ng batchmates nyo, yung mga little things kumbaga. madalas din kaming matakot kung sapat ba yung natututunan namin at yung mga concepts na na-internalize namin para maging mas effective talagang doktor in the future. In general, parang hindi. Although relatively mas nabibigyan recognition na yung mga doktor kumpara sa iba, lalo na habang mas nagiging specialized sila. Pag sinabing medical profession, di ba, parang ang unang may isip ay doktor. Kaya madalas nakakalimutan o hindi nabibigyan pansin yung ibang health professions kagaya ng mga nurse, pharmacist, PT, OT, speech path, medtech, at marami pang iba na ideally nga kapartner sila ng mga doktor para sa mas holistic na pagtingin sa mga pasyente kumbaga. Kaya sana mas ma-recognize pa natin na may kanya-kanyang role ang kada profesyon at walang mas mahalaga kumpara sa iba.
A big no. It's not given enough recognition as in general, kumbaga. Actually, we can apply this to the workforce in general. Not just the healthcare field, not just the health profession, not just our doctors or health allied members. Lahat ng workforce dito sa bansa natin, they are overworked, but they are underappreciated, undersupported, and undercompensated.
Hindi ko na-absorb kaagad yung gravity kasi kung hindi ako nagkakamali, parang hell week namin dapat pagkatapos nung initial na 1 week lang na suspension. Never ko rin talaga kasi na-imagine na may mangyayaring ganito sa buhay ko. Parang hindi talaga kasi totoo. Pero eventually, magsisink in sa'yo na maaalala mo kung paano nga pala yung healthcare dito sa Pilipinas. Tapos makakarinig ka pa ng balita na ayaw magsara ng borders kahit dumadami na yung cases natin. Kaya realize mo na lang na parang ito na yun, totoo na siya. Taga Nueva Ecija ako, tapos nag-high school ako sa Pampanga. Kaya ever since, nasanay talaga ako na mas maging independent. Hanggang college, ganun din, mas lumayo pa nga ako kasi umabot na ako ng Manila. Ngayon na lang ako ulit na pirmes sa bahay namin ng ganito katagal. Nasanay rin ako na palaging nakakatambay sa cafes or sa mga condo ng kabatch. And I think yun talaga kasi yung pinaka-helpful kapag nag-med ka. Yung shared stress, yung group studies, yung mga chikahan syempre in between. Kasi kayo lang din talaga yung pinaka-nagkakaintindihan. Nawala yung mga opportunities na yun nung nag-pandemic kasi maraming bagay talaga na hindi kayang tumbasan kahit magdamag kang tumambay sa, for example, sa Discord or sa Zoom. Yun ay yung kahit physical presence na talaga ng isa't isa.
Since right now, I'm still a fresh graduate from the Doctor of Medicine program ng UST. The major change that I experienced was during classes. And again, we still share the same sentiments dito. Nasanay tayo before na, of course, we grew up having face-to-face classes. That's the reality back then. But right now, we are stuck in the online setup ng learning. And aminado tayo, not everyone is privileged enough of undergoing online classes. So isa yun sa mga major changes na dapat nung 4th year ako ng Doctor of Medicine, I should have been in the hospital as a clinical clerk, yung tawag sa amin. Dapat nasa hospital kami, we should have been training face-to-face. But because of the pandemic, we were also mandated to do our trainings or lectures ng online setup. So that's one major change that happened sa amin. And kung iisipin natin, no, ano yung repercussion nito sa dulo or in the long run, yung mga current graduates natin of Doctor of Medicine, aminado tayo, we lack training right now because of the pandemic na na-expose kami lang sa online setup. So what we need then in the future is kapag handa na, kapag maayos na yung mga policies, is for us as soon as possible makabalik ng training sa hospital yung mga future medical doctors natin and other healthcare professionals.
Una, there is life outside med. At dapat i-recognize at sulitin natin yun habang maaga. Nagsisisi ako na hindi ko pa dinalasan yung mga paglabas ko kasama yung mga kaibigan ko o yung mga pag-uwi ko kada weekend kasi pakiramdam ko lagi akong busy. Hinayaan kong i-consume ako ng pressure ng ACADS lalo na kasi nga naging compressed yung pre-med namin. Hindi ko naman sinasabing lumabas na lang kayo at huwag na kayo mag-aral, pero kailangan talaga balanse. Kasi in the end, hindi naman ACADS lang ang buhay natin. Pangalawa, na-emphasize yung konseptong tinuro at inuulit-ulit sa amin palagi. Yun ay ang health is multifactorial. Nakikita ko yun sa pataas na COVID cases araw-araw o sa mga hindi nakakatanggap ng ayuda at wala na makain o yung mga non-COVID cases din na pag-iwanan na at na-neglect na kasi nga na-overwhelm na ng COVID cases yung mga ospital. Kahit kailan, hindi magiging isang layer lang ang kalusugan. Kaya as future physicians, kailangan nating matuto at masanay at magsapuso ng pagtingin higit pa sa karamdaman lang ng pasyente. Tandaan nating tao sila bago sakit.
I'll call it na lang a wake-up call instead of a greatest lesson. So, the wake-up call that I had during this pandemic was actually because during this pandemic, it was and is currently being highlighted that not all of us are privileged enough in having, in braving through these crises. So, ayun, wake-up call siya for me because nakikita natin ngayon na yung majority, not all, officials in the government right now really portray themselves as clowns and they seem to not have any sense of prioritization on what best things to do for our country. So, kumbaga, they have misplaced priorities and biases with currently unimportant factors for the pandemic.
Ang isang problema sa atin ay hindi nabibigyang halaga ang primary healthcare o yung mas preventive approach to health. Sanay tayo na magpapakonsulta lang tayo kapag lumalala na yung mga dadaing natin pero hindi tayo nasanay na mag-regular check-ups lang kahit wala pa tayong nararamdaman. Kasi nga, masanay tayo sa pag-cure, pag-treat, at hindi pag-prevent. Ang mas familiar na siguro sa karamihan ay yung mga secondary or tertiary hospitals na. So ito na yung mga ospital na nag-handle ng mga seryoso at yung mga komplikadong kaso na. Pero parang madalang tayong makarinig tungkol sa primary care hospitals at baka nga hindi pa tayo nakakapunta sa mga rural health units natin. Kaya kung may improvement sa Pilipinas, siguro isa doon ay mas papahalagahan ang primary care, mga primary care physicians, mga GPs, mga family and community doctors kasi tendency nating makalimutan kasing halaga rin naman sila ng mga specialized doctors natin. Lalo na kung gusto nga natin ng mas holistic na approach sa health na hindi nalilimita sa panggagamot lang ng mga sakit.
I've enumerated a lot of things na nagko-cause ng negative toll sa ating mga frontline workers or sa ating healthcare system. So, the best solution that we can do right now is first is to support the sciences and healthcare by providing rules and regulations or policies coming from the government and even private institutions na healthy para sa working force natin. Na kumbaga ma-eliminate natin yung abusive working conditions na pinagdadaanan right now. Second, of course, is to reallocate the funding of the government to proper directions. And right now, it's a pandemic. Anong solution ang dapat nating pinaprioritize? Solusyong medikal, hindi militar. So, reallocation of funds is number 2. And of course, number 3, yung thank you na nare-receive ng mga medical professionals ngayon, yung sabihan sila ng thank you for being our heroes, thank you for saving our patients. It should not just stop from thank yous, should not just stop from posting publication materials. We need to help them call for a nationalistic, community-based, scientific, and medical approach towards our current situation.
Kung napunta na kayo sa PGH, sigurado ako na kahit anong oras pa yun, makakakita kayo ng bantay o kahit nga pasyente na nakaupo sa sahig. Kung swerte, may monoblock. Pero marami din na nakaupo na lang kahit nga nakahiga pa sa semento. So PGH na yun na yung referral center kahit pre-COVID pa ng mga kasong hindi na na-handle ng mga ibang probinsya. So nakapag-interview pa kami dati doon ng isang bantay na may dalang bag. Wala raw silang kakilala sa Manila, wala silang tutuluyan at galing pa sila ng Palawan. So, ito na dapat yung cream of the crop pagdating sa mga public tertiary hospitals. Pero ganito na yung naranasan ng mga pasyente. Paano pa sa ibang ospital, di ba? Kaya, sa tingin ko kahit anong rason ng pagpili mo sa med, for example, gusto mo yung buhay ng mga characters sa House or sa Grey's Anatomy, sa tingin ko, karamihan na nagsistay ay yung nakakita ng kakapitan dahil na-expose na nga sa realidad ng healthcare sa bansa. So, mas malapit sa kwento ng New Amsterdam. Hindi naman dahil naniniwala kang kaya mong baguhin yung sistema overnight o yung gusto mo maging tagapagligtas, hindi ganun. Pero more of, gugustuhin mo talagang makatulong sa kahit anong paraan, kahit gaano pa kaliit o kasimple.
Let's say muna na yung motivation levels ng isang tao. It's not always 100%. Kahit nung estudyante pa lang ako, may mga times na I hit rock bottom, my motivation is at 0%, ganun. So, what I do is to deal with things on a day-to-day basis na hindi ko nira-rush yung sarili ko na ma-motivate parate. If I see something wrong, if I see something bad happening, we correct that bad or negative thing. So same as true with my motivation. If I see something draining my motivation, I try to go away from that, shy away from that. Tapos I take things day by day, take time to feel the emotions that I have. Kung malungkot ako ngayon, hindi ko pipilitin yung sarili ko maging masaya. So, I always try to remind myself to be motivated in this path. It's really hard. That's the reality. But after every time na maging successful ka or even just talking to your patients, yung makita mo lang yung mga simpleng ngiti nila after you talk to them, you give them reassurance of their conditions. You see their faces lighten up after a very tiring day of consultation or falling in line sa hospital. That's what makes me or keeps me going throughout this pandemic.
Isa po kayo sa mga inspirasyon naming mga mag-aaral. Araw-araw kaming magpapasalamat at habang buhay kami magpapasalamat, lalo na sa naging pagbubuhat nyo ng pandemya. Sana makamit nyo po ang proper compensation, recognition, at higit sa lahat, pahinga. Kasi deserve nyo po lahat ng mga bagay na to. Again, maraming salamat po.
So I want you guys to close your eyes first as you listen to this message. So close your eyes in 3, 2, 1. So don't open yet until I tell you to do so. Okay? So imagine yourself waking up in the morning, doing your daily routines. Toothbrush, breakfast, bangon sa kama, ng pillows, and kumot. After that, you ride your car going to your destination or mag-commute going to your destination. And after a few minutes, you finally reach your destination. Okay, yan, naglalakad ka. Turns out that your destination is a hospital. Now, you get out of your car, you get out of your jeep or commute, you start walking towards the entrance. As you walk through the hallways of the hospital, you see patients of different kinds. There are patients na umiiyak, sumisigaw, patients na nakahook sa IV lines, patients being resuscitated or revived, and also the faces of the different workers you've come across or worked with. And finally, ito na, malapit na tayo magbukas ng mata. You reach this door. Sa pintuan na yon, merong label. Nakalagay yung pangalan ninyo. Tapos nakadugtong doon ay MD. Turns out that this is your clinic, your doctor's clinic, your very own doctor's clinic. And as you enter inside this door, you sit on your desk, imagine the surroundings, imagine the design of your clinic, and then after a few minutes, someone knocks into your clinic and comes in. It's one of your former patients. The patient tells you, Doktora, salamat. Dahil sa'yo, magaling na ako. Dahil sa'yo, nakakasama ko na yung pamilya ko. Dahil sa'yo, hindi ko na kailangan bumalik pa ng hospital para magpa-check up ulit. So now I want you guys to open your eyes. Okay. So imagine that yung doktor na nakaupo doon sa desk na yon, kayo yon, tayo yon, binalikan tayo ng pasyente natin. And yung doktor na yon, ang pinagdaanan niya is years and years of medical studies, years and years, countless of coffee, countless liters of coffee, crying, blood, sweat, and tears, sleepless nights. It all started, it all ended, but started on that point na sasabihin sa'yo ng pasyente mo na salamat. And all of those were possible because you kept on going despite and in spite of how hard the path towards medicine is. So my take-home message for everyone is keep on going. If you become tired, take a pause. It's never wrong to take a rest and take a pause. We're but human beings, we're limited beings, so acknowledge that. And after you recharge, go on again towards your dreams. So yun, laban lang tayo. Thank you.